Hello and good evening. This is Kuldeep Chaudhary from Health in India. We're here in room number 2603 at Artemis Health Institute. We are with the patient Marina, who's flown in from Afghanistan about a week back. She got admitted at the hospital. She had come for cervical spine surgery, and the doctor back in Afghanistan had recommended Dr. Rajesh Verma, who's the topmost spine surgeon out here in India, for this surgery. When she landed up at Artemis Health Institute, the team of doctors of Joint and Spine Institute, they did a thorough investigation and they realized that her problem was not only cervical spine, but she also had a frozen shoulder. So therein the joint specialist, Dr. IPS Oberoi, joined the process of the treatment, and finally it was decided after all the investigations that she'll undergo a cervical disc replacement surgery and an arthroscopy for correction of the frozen shoulder. It's the third day of the surgery. The recovery is remarkable. Marina is just about to get discharged from the hospital, and they'll be in India for about 2 weeks. Let's talk to the doctors about this particular case. So, Dr. Verma, you did this procedure. Let us know what exactly a disc replacement surgery is.
Disc replacement, like any other joint replacement, is meant to give mobility, because there are lots of disadvantages. If we fuse the cervical spine as we used to do it earlier, there are chances that other locations, one disc above or one disc below, may get degenerative changes very fast. So that's the reason we decided in young patients, as there was no other problems in the cervical spine like posterior facet joints and there were no osteophyte formation. So we decided to change the disc. In disc replacement, we don't fuse the cervical spine, we don't apply any plates, we don't apply any bone blocks which we used to do earlier. Rather, we put two plates, titanium plates, and in between that there is ceramic mobile platform over which all the movements, flexion, extension, rotations, side bending, like before, all movements are possible. So it's a wonderful procedure suitable for young patients when there is no other morbidity associated with cervical spine.
And most of the replacements we hear are very expensive procedures, but this entire procedure, I mean the shoulder arthroscopy and the disc replacement and all, were done under $10,000 US. So what kind of implants are these?
Implants are FDA approved, best quality titanium and ceramic implants by Globus company, Medtronic company. These are and AO. There are 3 implants which are FDA approved. We use only these implants after discussing with patient whatever his preference may be. So these implants usually cost around $3,000 in India. So we are able to manage in below 10,000 both the surgery. Since it's a teamwork, so cost is taken care of.
So you did 2 surgeries and the same setting, so obviously the costs were shared. Dr. Oberoi, you do large number of joints and you are a specialist in arthroscopy. Patients from US and all over the world, they come to you, and we've interviewed you earlier when you did hips and you've done knees. How difficult is the shoulder joint?
Shoulder is a very mobile joint, and this joint requires skill in both the manners. And you have to make the ligaments balanced in such a manner that once you are doing a release of a stiff shoulder, the shoulder does not start dislocating out. So it's a calculated kind of release, much different from other joints. Other than that, it's a deep joint. Unlike knee, where you can just open into the joint and go into the knee. It's a very superficial joint. Shoulder is a very deep joint. So this makes this joint less popular among surgeons to do surgery, because there is deficiency of training for people doing shoulder surgeries. In her case, it was a stiff shoulder, and we operate every single day shoulders like this. Diabetics do have a tendency to become their shoulders stiff. Incidentally, because of her neck and the shoulder problem, she was in agony and a lot of pain. Now the shoulder had become quite stiff that even rotations were restricted, reaching to the back was not possible. And I don't think she was not even able to comb her hairs also. And that makes the shoulder very much stiff. But the surgery was relatively minimally invasive, so you just make 2 or 3 small punches into the shoulder. From back of the shoulder, we put in a small telescope. The diameter is just 4 mm, it's a very thin telescope. Look into the shoulder. There was a lot of swelling and inflammation, and we record this surgery and give a DVD. And then we have special laser probes. These are called as coblations. They don't burn the tissue, they don't cut the tissue. They vaporize the tissue. So any tissue which is actually scarred and fibrotic and thick, you just become soft and loose. So the shoulder, which was very tight, with help of this coblation technology, we were able to globally release the shoulder, and all the movements were restored on the table. So on the table, we were able to actually reach out to all the places. And that is why next day morning I was confident that she would be able to do all the activities, provided she stimulates her muscles to do it. Passively I can take it now also, but her muscles have never been used for the last so many months and have become weak. And that is why just before this I was talking to her that she requires 3 months of good exercises so as to stimulate the muscles in the front, back and side. So these movements come back actively. Passively, yes, we did it today morning also. She was able to climb the roof and she was able to do it. The pain will remain for some more time, but her movements will dramatically improve, I am sure about it.
So 3 months later, she should be able to do everything with the hand which has been operated upon, just like she does with
Exactly. She asked me when I can play with the kid. I said, can you lift the kid now also? But you can throw the kid into the air and play with the kid after 3 months. And I'm sure she will be able to do that.
That's wonderful. So Marina, you were a little anxious just before the surgery. Every patient is. Today you're about to get discharged. So what has been your experience about the hospital and the doctors over here?
Actually, now I'm so excited to be discharged from because I've never thought that 2 surgeries at the same time would be happening to me, and I will be recovered very soon. So I hope that I will be a normal person after some days, that, as doctor said.
Inshallah.
Inshallah, yes.
So Masood, it's been a week almost now in India, and you've been around the city of Gurgaon. India and Afghanistan always had great friendly relations. In fact, the president of Afghanistan, he studied in Shimla and he's been a frequent visitor to India. So how do you find the people? This is of course not your first trip. You have been earlier to Max Hospital. You've studied in Japan. You've traveled all over the world. So what do you have to say about the Indian healthcare?
Yes, of course. When we arrived to India, so we find the people, the Indians are so friendly. We didn't face any problems. Even when we come to the hospital, the service was really in a high standard, and the treatments of the people with us, the way that they communicate with us was really good. I'm 100% sure even Marina is also. No problem, we didn't face any problems. Just before the surgery, we was worried what would happen to Marina. And the surgery was done successfully, and now she's feeling well, no problem. So we are so happy here, and we really enjoyed staying here, and also in this hospital we didn't have any problems.